Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Rountree.
Hey, thanks for joining us again this week on the Laser Therapy Institute podcast. I am Dr. Jason Rountree. I'm a chiropractor and certified medical laser safety officer. And I have Kristi here with me again today. Good morning, Kristi.
Good morning.
Kristi is a certified laser tech, and she's also our education developer here at LTI. So, multi-talented individual. We are going to be talking about research today, laser therapy research, which is something we usually do on the podcast. And we're going to be discussing a very new study on wound healing. Kristi, when you hear wound healing, what do your thoughts go to right away?
Pain,
yes.
Pain, inflammation, redness, just all that.
So in this case, we're going to be talking about chronic wounds, and chronic wounds are the wounds that open up and then they don't heal. They never close up. We've seen a lot of this actually in practice. You've treated a lot of this?
Yes, I have.
Yeah. So the thing that we've been lacking to this point is a lot of good studies about high-intensity laser therapy and chronic wound healing. Chronic wound healing is really difficult to manage because it's like the body doesn't want to heal it. It just doesn't have the capacity to get that wound to close up. And so we've seen wounds as small as, a quarter, and we've seen wounds take up most of someone's leg.
Correct.
Yeah.
Correct.
How's that stuff smell?
Not pleasant.
No.
Lots of oozing, lots of wetness, and it's just not pleasant for anyone around. Especially the patient. It's just aggravating, and just want to see that heal.
Yeah. So this study is from BMJ Open, and the title is Clinical Effects of High-Intensity Laser Therapy on Patients with Chronic Refractory Wounds, a randomized controlled trial. This came out just this year. I believe it was April of this year. I'm sorry, June of this year. And it talks quite a bit about utilizing proper dressing, but then also high-intensity laser for these wounds. So they say that chronic refractory wounds refer to wounds that cannot heal with conventional treatments for more than 1 to 2 months. So that means this opens up, becomes a problem, does not start to close up with regular, like wound dressings for 1 or 2 months or more. And they develop into chronic ulcers, multiple drug-resistant bacterial infections of the incisions, if in the case of incisions, and then subcutaneous fat liquefaction. Tasty. Yeah. Yeah. Refractory wounds can be caused by trauma, burns, pressure injuries, venous leg ulcers, post-operative infections, and diabetic foot ulcerations as well. And that is what we've seen in a lot of cases, those diabetic wounds, that they open up and then they just do not heal. And these are people with really poor circulation, a lot of times uncontrolled diabetes, or just severe diabetes.
Well, and often those seem to lend itself towards, if they don't heal, there's more drastic measures that are taken, amputation and that sort of thing.
Yeah.
So healing the wound is critical.
It is. Yeah, because amputation is a very real outcome for a lot of these people when they don't heal, when that wound does not close up, because it tends to grow, tends to get worse and worse. You end up with bone infection. You end up with some really significant problems. So if you're in practice and you've been treating wounds at all, then you know that dressing is very important. But you also know that there's not a lot of other great options for people who have wounds that will not close up. There are some regenerative options now where they can use an afterbirth product, which is usually a placental product, and that's designed in sheets. You can lay that into the wound. Those are very expensive. They do help. They do seem to work, but that's kind of an outside-in approach, and outside-in isn't always good when you have poor circulatory function to that wound bed.
Right.
So, bandaging is important. Anything you can do regenerative that way is definitely good. But again, if you're just working from the outside in, you have a lot of limitations. Mm-hmm. Mm-hmm. So these researchers here, this is actually a Chinese-based study, and they included, let's see, quite a few patients. 60 patients are enrolled in this study, and they were between the ages of 30 and 65. They had to have open full thickness wounds, such as post-operative wound issues, diabetic foot ulcers, and pressure injuries. And then they had to demonstrate this presence of a chronic wound, which means that it had already failed conventional treatments for at least 1 month or longer. Okay. And so then half of these patients were placed into a control group, so 30 patients into a control group, and then 30 patients into the experimental group. Now, the control group got 3 times a week dressing, and excellent dressing, pretty much what you would see standard in wound care. Okay. But then the experimental group, they had that same schedule of wound care with bandaging, but they also got laser 3 times a week. So every time that the bandaging got changed, they would also have a laser therapy treatment. Okay. And so they compared these folks, obviously at the beginning of this experiment and then at the 3-week mark when the experiment was done. So 3 weeks of bandaging for everyone. And then with the experimental group, they also got 3 weeks of light therapy, laser therapy, specifically high-intensity laser therapy. Mm-hmm. So they had measurements taken for the pretty much standardized kind of outcomes. So Bates-Jensen Wound Assessment Tool, the Pressure Ulcer Scale for Healing, or a push tool as well. And that measured things like the size of the wound, the visible depth, what the wound edges looked like, if there was undermining and tunneling processes, if there was necrotic tissue, actual dead tissue present, the exudate, like you were talking about, a lot of wet, a lot of drippy. Mm-hmm. Yep. And then the surrounding skin discoloration is considered in there too, because we know that as these ulcerations grow, the edges of the wounds get really kind of start to fray away, and you can see even like surrounding skin looks unhealthy.
Yes.
So these outcome tools kind of measured all that for both groups, and that's how they did their comparison to see who would get better faster. Now, the laser they used was kind of an interesting laser. It's a class 4 laser. It uses only 1064 nanometer beam, so that's a little bit further into the infrared. A lot of times we'll see lasers in the 800 to 1000 range. Right. This is just a little bit further out, but there's been a lot of really good studies with 1064 that have come out just in the last couple of years. So I've not seen too many studies about wound healing with 1064. That's where we'll a lot of times see the visible red, sometimes even visible blue, which both of those can be very effective. But so when I saw this, I was really interested to read to the end and see what the results were.
Now, does that wavelength go deeper?
So actually, yeah, let's talk about that wavelength for a second. There's a few lines in here where I might not be able to totally agree with the researchers, but I'm still going to read that off because it does give us some information about at least how they view the 1064 wavelength. Again, this is an invisible infrared wavelength. You know that, right? So it doesn't look any different to our eyes than like an 800, but it is quite a bit different as far as how it absorbs into the tissues from 800 or from 905 or from 660, right? All these wavelengths of light behave very differently. And of course, there's no radiation or anything like that with these. They're very, very safe. But these researchers say that using a laser with a wavelength of 1064 nanometers provides the best absorption and penetration into tissue, as its absorption by tissue chromophores such as hemoglobin, melanin, and water is lower, thereby enhancing the wound healing process. That's kind of a confusing statement because if you've got low absorption, how does that absorb, or how does that stimulate the wound healing process? I think what they're going for there is just saying, hey, it can get in very deep. Okay. 1064 can penetrate quite deep. It's not as deep as 800. Okay. We do know that. So I have to kind of disagree with the researchers in this particular line. However, it does have very minimal scattering. So
Which is key.
Yeah, because as the photons go into the tissues, once they encounter water and blood and proteins, they tend to want to disperse and scatter into superficial tissues rather than traveling on into deeper tissues.
And what we're after is the inward out healing.
Right, we need to get into those tissues. But at the same time, some scattering could be good because we're talking about a wound. It's a fairly superficial tissue. So we know from other studies that 1064 does penetrate quite well, and it has minimal scattering. So it should be getting quite a bit in deep. To compare, like 800 nanometers, we know 800 nanometers goes very deep. It goes the deepest out of those wavelengths as far as we know at this point. But it also has a lot of scattering. So it may be able to get a lot of photons in deep to the tissues, but it also means a lot of it gets dispersed on the surface. Right. So in this case, using 1064, I think definitely gets us through that wound bed into the healthy tissues below, but stays a little more focal on the tissues we're treating rather than seeing a lot of beam spread.
Okay.
So 1064, they say, has other beneficial properties. It provides photobiomodulation, which is our new laser therapy term, by inducing increases in oxygen consumption, endogenous ATP synthesis, and fission rate rhythm. Further, this has been demonstrated to be the optimal wavelength to activate autophagy. Do you know what autophagy is?
I was going to ask, what is that?
So that is a process where immune system cells eat up unhealthy tissues.
Okay.
And they say but this can promote cell metabolism and maintain normal physiological activity and homeostasis. So, and then also can promote the production of cytochrome oxidase and increase cellular or mitochondrial calcium uptake. So there's a little bit of confusing language here, and I think it's just probably the Chinese to English language barrier more than anything. But essentially there we're talking about increasing metabolism of the tissues, right?
Right.
So that's an important thing. If you're trying to promote wound healing, you need new healthy tissues.
Right.
And so if you can stimulate those from the outside in, but also from the inside out, then you get wound healing from that wound bed, from below that area, healthier and healthier tissues that are replicating, so you get more healthy cells, right? That's how you get wound healing.
Right.
Okay, so let's talk about their settings real quick here. They used this 1064 nanometer high intensity laser. They used a setting of continuous wave and 8 watts of power. Now, they did say they used a very small beam size, 1 square centimeter. I don't know that that's really correct. And this particular laser, I believe, uses a 20 millimeter or 25 millimeter diameter spot size. So this is probably just, again, a little bit of a miscommunication. But what I found most interesting is they used a very high dose. And we measure dose for light therapies in joules per centimeter squared, right? So a joule is a packet of energy, a unit of energy measurement. And then that has to be spread out over a certain area. So the bigger the wounds are, right, the more laser you need to deliver there. Right. And the smaller the wound is, the less laser you need to deliver to get the same number of joules. Now, wound healing, they recommend between like 1 and 8 joules per centimeter squared, somewhere in that range. Has been what's typically recommended. These guys did 80 joules per centimeter squared. That's a very high dose.
Yeah.
Very high dose. Fairly high power, 8 watts. So this is quite a bit of light they're pushing in here. Definitely well above the kind of norms, well above what's typically recommended. And then again, using 1064 is kind of uncommon for wound healing. So how do you think they did?
Well, you want to think more is better.
Right?
You want to think that.
Yeah.
But we know from experience that's not always true.
Correct.
So, I'm curious. What were the results?
Well, before I get there.
Okay.
You're exactly
make
right.
Us hang on.
I'm going to make you wait. But no, you're exactly right. We tend to think as humans, more is better, and especially, there's lasers out there that'll push 80 watts of power. I mean, you can do a lot of laser really quickly, but it is, we do want to stay away from that idea that more is always better. Sometimes more is better. Sometimes less will give you better effects too. And that comes down to not only the power setting you use, but your spot size,
Right.
And the time.
And the time.
How far away from the actual wound, how far away you are from the tissues are you holding that handpiece? How many times a day are you treating? How many times a week are you treating? Is you just treating once and then you're done? So these guys, again, they treated 3 times a week. They did this for 3 weeks. They did fresh bandaging that exactly matched the control group. And they saw no negative side effects. Nobody had any burns or anything like that. So it was proven to be very, very safe across the experimental group. No pathologic symptoms. So specifically burns.
Okay.
Okay. Let me switch over here. So again, no side effects. Let me get to my conclusion. Where'd it go? There we go. So they said that the conclusion that high-intensity laser therapy in combination with wound dressing was superior to conventional wound care for the treatment of chronic refractory wounds. And in this case, they saw about a 50% improvement within 3 weeks for these wounds in the experimental laser group, whereas the people who were getting the regular wound care did not see that level of improvement. So 50% more improvement in the laser therapy group as compared to bandaging alone.
Wow.
Yeah.
That's significant.
It is significant, especially when you consider that these wounds have been open for a month or 2 or longer.
Right.
And some of them have a lot of factors working against them, like infection and diabetes. So it's difficult to get that healing in the first place. So in just 3 weeks to be able to see that is impressive. Now,
Yes.
here's something, though. They said that significant differences could only be seen from the second week of treatment, meaning that in that first week, they really couldn't tell any difference between the laser group and the control group.
Well, sometimes laser therapy or light therapy has a little bit of a delayed reaction because it needs time to get the metabolism and the blood vessels and all that working, but then it's an exponential increase after that. That's been the experience we've seen with other types of treatments. And so it makes sense with a wound that you might not see something right away, and that can be discouraging. However, after a week, 2 weeks, 3 weeks, to have 50% increase, that's impressive.
Yeah, it is a big deal. So clearly, there's some value to these settings, at least, this higher dose level. You can get 80 joules per centimeter squared out of a low-powered LED. It's just going to take a long time.
Speaking of which, how long were these treatments?
Yeah, that's the thing. They don't tell us. But
okay.
in this case, that's because all these wounds are different sizes. So
Gotcha.
if you have a wound that is, say, 1 square centimeter, these guys delivered 80 joules, which with an 8-watt laser is only going to take, how long is that? It's not very long. It's very
long.
quick. It's like 1 second.
Yeah, very quick.
80 joules, actually 10 seconds. 10 seconds. 10 seconds on that. So, but if you have a larger wound, like a 10 centimeter squared area, then you need to deliver 800 joules to get 80 joules per centimeter squared, right? So that's going to take longer.
Right.
So then if these really big wounds, they take even that much longer. So that goes back to picking the right laser device for what you're doing. If you're going to try and do a reasonable time level, in clinic, if you're not going to sit there for 2 hours,
Right.
then you need to have a pretty high intensity device to hit 80 joules per centimeter squared if your wound is any size. And like I said, we've seen wounds from quarter sized all the way up to
The whole leg.
Yeah. So delivering that level of power takes a long time. It takes a long time. If you have an area that's, say, 1,000 centimeters squared, which is, not crazy to think about. That's about a whole leg. Then you've got to deliver 8,000 joules.
Right.
That takes a long time. If your laser power is 8 watts, like these guys was, then delivering 8,000 joules, 8 watts, it's going to take like 10-ish minutes, I believe, if I'm doing my head math right.
I'm leaving that to you.
Thanks. And I get a little bit tied up on some of that sometimes. But I mean, that 10 minutes isn't bad. But if you're only using, say, a laser that will go to half a watt, that's going to take hours.
It is.
Yeah. So choosing the right device for clinical work is important. You might can get away with something lower powered LED type device for especially like home use for patients. But if you're going to pick a laser for clinic use,
you need something that's going to work.
Yeah.
It's going to be more effective.
Yeah.
So not that others aren't.
No.
It's just the time factor is a big deal.
How long do you want a patient sitting there?
Right.
How long do you want to sit there
Right.
having to attend to this, or even if
you've got your techs and you've got your other personnel in your office and your clinic. It just takes away resources to be able to help other people. Not that we're not focusing on that one patient, because that's critical, but we also need to make sure we're able to help more.
Well, yeah. I mean, if it takes you 2 hours to deliver a treatment to a wound, you're going to get like 4 of those in a day at most.
Yeah.
But if it takes you 10 minutes, you can get 4 of those in an hour.
Right.
No problem. Right. And there's a lot more people you can help. Exactly.
More people to help. That's it. There are a lot of people who suffer with this chronic wound healing issue, and this can give them some hope.
Yeah. Absolutely. It's really important. It's really important to be able to deliver some results on something like this. So there are some takeaways here for us. Number 1, we don't know all there is to know yet about dosage.
Nope.
We have recommendations from like the World Association of Photobiomodulation Therapy, and those are a good starting point. But clearly, going outside of those bounds, in some cases at least, appears to show some level of benefit. In this case, going very high on the dosage. We're not sticking to 2 joules per centimeter squared. We're going to 80 joules per centimeter squared. That's a very high dose.
That's amazing.
The other takeaway is that sometimes it takes time. Give the body time to respond to what you're doing. Don't do 1 or 2 treatments and then give up.
We're too instantaneous. We want things so fast, but sometimes it does take time. We do need to be patient. And obviously after a week, the results started showing. But it took that week. You start something, it doesn't take a short time to start. Usually, a wound is festering for a while if it's chronic, if it's not healing. But after a week of treatment to see improvement, that's amazing, and that gives a lot of hope that this could work. And does work.
So set the patient up for success by letting them know it's not going to be overnight. It's going to take some time.
It's going to take some time.
At the same time, don't work on it for 3 months seeing no results.
Right.
Set up a reasonable time frame where you expect to see the results, and the patient expects to see the results. And then if it's not working, figure out something else. In some cases, it might mean increasing your dosage or treating them more often. In some cases, it might mean cutting back your dosage.
Well, and each patient is going to be unique. You can't have a one for all, just like the wound size.
Right.
The patients have different histories, even though it's still the common non-wound healing, or healing the wound not healing.
Yeah.
But
they actually even said in here that a major limitation of their study is that they had a variety of wounds with different causes, pathologies, and locations. So that leads to confusion as to the best application of this technology. That's what they say here. So, we can't really break this out by wound type, and we can't get beyond, the general 80 joules per centimeter squared kind of guidelines here. So I think it's important, too, to remember that getting good guidance and setting up your laser therapy systems well with the right settings and the right protocols is important, which is why we do what we do.
That is
what we do here at LTI. We equip practitioners to be successful with their laser therapy protocols. We help find the right laser devices for practitioners as well. We train and certify staff members. There's a lot we can do for you to make sure that you can be successful with your laser therapy programs. And again, look at your dosing, look at the laser you're using, give the patient time to see those results. And then lastly, remember, you can't just throw bandaging out the window. These participants in this trial had good bandaging protocols. That is still important. But when you're changing that bandaging, maybe take the advantage of that opportunity to get some light into that wound.
Sounds like a great idea.
Cool.
Yeah.
Thanks for joining us today.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.